We'll now hear from Karen Larsen from the Steinberg Institute.
Thank you. Thank you so much for holding this important hearing and for inviting me to join you today. My name is Karen Larsen. I'm the CEO for the Steinberg Institute. We're a nonprofit public policy institute dedicated to transforming Californians' mental health and substance use care systems. We were also proud to partner with Senator Wiener and the Kennedy Forum on SB 855. But passing this bill was only a piece of ensuring access to affordable, high-quality care. Our implementation must meet our aspirations. Any law is only as strong as our ability to enforce it. In the 2021 budget, DMHC received $2.7 million to conduct behavioral health investigations of all full-service commercial health plans, to evaluate their compliance with parity, and to assess whether their enrollees had consistent access to medically necessary behavioral health services. The legislature clearly intended that DMHC thoroughly evaluate parity compliance as a part of their investigations when it approved this budget. Right now, their compliance evaluations are fundamentally flawed. Here's why. In addition to SB 855, the federal parity law, the Mental Health Parity and Addiction Equity Act, is one of the strongest tools available for state regulators. This tool, referenced in our state law, requires commercial health plans to conduct detailed parity compliance analyses on treatment limitations in each classification of care. These analyses often show failure to comply with common parity violations, such as limitations on autism services, limitations on medications for opioid use disorders, and prior authorization requirements. In the batch of compliance reports that were released yesterday, the agency did not include this analysis, saying it was too complicated. This explanation doesn't hold water. The plans are already required to complete these analyses for the federal government, and all DMHC has to do is release them. In Illinois and New York, regulators looked at this analysis and found widespread noncompliance across all types of services amongst plans. If other states can do it, why can't we? Public transparency is a critical piece of enforcement. It is essential that any results from these federal parity analyses be made public as a part of behavioral health investigations. We further assert that failure to analyze compliance with federal parity is in direct opposition to the legislature's intent when it improved the department's budget change proposal in the 2021 budget. The DMHC's failure to release the results of the parity compliance reviews as a part of these public behavioral health investigations is deeply disturbing. We understand that fulfilling the promise of federal and state parity are hard work, and we expect nothing less for Californians. Last week, the DMHC announced a record settlement agreement after an extensive investigation of Kaiser Permanente's behavioral health practices. We see this as an important precedent and believe that continued vigilance is required, as these practices are not just reserved to Kaiser and are hurting Californians on other plans. We call upon DMHC to release complete summaries of all reviews conducted of plans' federal parity compliance analyses when it releases the results of the behavioral health investigations. We appreciate today's discussion and would welcome the opportunity to discuss how the DMHC is incorporating these reviews of plans' federal parity compliance into their behavioral health investigations. Thank you to Senator Wiener for your partnership to advance parity in California, and to the committee for your collective efforts to improve the mental health of all Californians.
Thank you very much.